unique new product is now available to aid women in performing breast self-examinations. It is called BD Sensability Breast Self-Examination Aid. Using standard breast self-examination techniques, the BD Sensability Pad is an aid to the process. This product has been designed to reduce friction and may provide for an easier and more comfortable exam. Please read the instructions included with the package for proper use of this product. Breast self-examination should be performed both standing up and lying down with and without the BD Sensability Pad product. Breast self-examination with or without the BD Sensability Pad is not a replacement for a mammogram or a clinical breast exam by your doctor. It is very important that you have regular clinical exams and mammograms as advised by your doctor. Report any changes found either with your bare hand or the BD Sensability Pad exam to your doctor for proper evaluation. You should examine your breasts once every month within a week after the end of your menstrual period, when your breasts are least likely to be tender or swollen. If you have stopped having periods or if your periods are not regular, continue to examine your breasts every month, preferably on the same day of the month. Choose a day that's easy to remember and mark your calendar. The following demonstration will show you the proper technique for performing breast self-examination with the BD Sensability Pad. These instructions for performing a breast self-examination should be done first with your bare hand. Once you've completed a bare-handed breast self-examination, it's time to use the BD Sensability Pad. The first part of the self-exam is done while standing. Begin using the pad by rubbing it between your hands to warm it to body temperature. Hold the pad in your right hand. Raise your right arm while holding the pad over your right breast. Having your arm raised will distribute the breast tissue more evenly for a thorough exam. Press the flat side of your left hand fingers firmly against the pad and move your left hand in a circular motion, as demonstrated here. Be sure to feel directly beneath the nipple. Slide your hand over every part of your breast and armpit. You're feeling for a lump, a thickness, or anything out of the ordinary. It's important to examine the area between your breast and armpit, including the armpit itself. The lymphatic vessels and lymph nodes are located here. These are some of the most common locations for breast lumps. When you've finished examining your right breast, repeat the procedure on your left breast using your left hand to hold the pad over your left breast. Remember to examine the entire breast and armpit. The second part of the exam is done while lying on your back. Choose a comfortable location and place a pillow under your right shoulder. The pillow is placed under your shoulder to aid in the even distribution of breast tissue. Hold the pad in your right hand and place it over your right breast. With the flat side of your left hand fingers pressed firmly on the pad, begin moving your left hand fingers in a circular motion, gliding the top surface of the pad over the stationary surface of the pad. In this reclining position, your breast tissue spreads out over the chest wall, making it easier to examine the deeper tissue layers of the breast. When you've finished examining your right breast, move the pillow beneath your left shoulder and examine your left breast. Take the time to do a thorough exam. For the third and final step of the breast self-examination, stand before a well-lighted mirror. Inspect your breasts for anything that looks unusual. Are there any changes in the size or shape of your breasts? Do your nipples look the same? Now, raise your hands above your head and make the same observations. Raising your hands over your head will better expose the lower surface of your breasts so that any changes are easier to notice. With your palms at your sides, look for any skin changes, such as dimpling or puckering. Place your palms on your hips and press down firmly, flexing your chest muscles. Check for any changes in the appearance of your breasts. Check your nipples for any discharge by gently squeezing the nipple. Nipple discharge is not uncommon, but any discharge should be discussed with your healthcare practitioner. If you do discover a lump, dimpling of the breast, or nipple discharge, see your physician for a prompt and thorough evaluation. It's reassuring to know that approximately 80% of all breast lumps are not cancerous. However, that's a determination only your physician can make. Good breast health care is easy to practice. First, examine your breasts regularly so that you'll become familiar with what's normal for your body. Report any persistent